Hello, everyone. I'm Jay Beery, CEO with Plymouth Place, and I'm honored to have Dr. Kumar here today. Dr. Kumar is one of our medical directors here at Plymouth Place. He works in partnership with Dr. C, and we're so honored to partner with him, not only as a medical director, but as a friend and a partner, especially during these days, because he has been a huge resource, thank you, Dr. Kumar, with regards to managing issues and policies and procedures related to COVID. So he really is our go-to and one of our subject matter experts. So with that said, Dr. Kumar, can you tell me just a little bit about your background and experience so our listening audience gets to know you once again?
Certainly, Jay. It's a pleasure always to be here at Plymouth Place. I'm a geriatrician, an internal medicine and geriatric specialist. I've been practicing in the LaGrange area for 20 years. I was the lead physician for the Adventist Midwest Geriatrics, and then we went private. Dr. C and I and 8 other partners were part of that. Now we work with DuPage Medical Group. I also work as the Chief Medical Officer for Cimbria. We provide some post-acute rehab and pharmacy services, and I work as a Regional Medical Director for Prospero Health, providing some home-based care for chronically ill elderly patients. So all my experience and my life's work has been in taking care of seniors. And Plymouth Place has been a very good place for our team, my practice, and it's always a pleasure to come back here.
Dr. Kumar, thank you. And for our listening audience, you may not know, Dr. Kumar has been featured on NPR, PBS, Fox News 32, and other stations to get his expertise advice on COVID. And so we are honored to have you to share this today. So we're going to talk a little bit about the fall and winter and beyond, because a lot of people have said, well, when will this end? What will happen in the fall and winter? What are some additional things we could do? And in partnership with the leadership team, the board, Dr. Kumar, Dr. C, we have implemented a number of things, and we're proud to say we've been COVID-free here at the campus since June 5th. Part of that is because of the protocol and practices that we put in place many, many months ago, including the dedicated isolation unit, which is empty because no one has COVID on the campus, but we're ready if and when that happens. Some of the technology we put in place, which is the infrared systems, which takes temps of all employees every single shift, and anybody coming into the building who's considered an essential care worker. Bipolar ionization, which basically does air scrubbing. And this technology is really important. It's been around for a while, but COVID-19 is airborne, and scrubbing the air is extremely important, and that's in place in our assisted living areas and also our skilled areas of the building. And then last but not least, the ultraviolet ray. We have UVC, which does the contact cleansing post-cleaning. And of course, additional housekeeping. We do weekly testing with employees, which will continue. As a matter of fact, we're on our really 3rd generation of testing, and we are looking at ways we can get the 4th generation, which is the saliva test, and more to follow on that. So that said, I think those have been some good practices, and Dr. Kumar will remind us that wearing the mask, hand washing, and the distancing is really, really important, and those practices will, continue. But Dr. Kumar, any comments on those practices in Plymouth Place and kind of where we are? Any other thoughts before we talk about the fall and winter? What would you say?
Well, kudos to you, Jay, and the team, the Plymouth Place team. We've done a wonderful job keeping COVID at bay. We recognized early that establishing these policies and procedures, cleansing, disinfecting, and training our staff and teaching our seniors, our residents, to maintain the physical distancing and the hand hygiene, the mask that we recommend everybody wear all times. These have really helped keep COVID-19 in check in Plymouth Place, and I'm really impressed. And I see often that senior living communities get an outbreak and then have a little lull, and then they get back and have another outbreak, because seniors are very susceptible, very much susceptible to this infection because of their age, their frailty, and because they are immunocompromised in a lot of situations. But our team here has done a great job. And in fact, if you're living in the community and are concerned for your safety, Plymouth Place would be a really good choice because we have such a good team and such great practice of safety and hygienic practice of medicine in this community.
Dr. Kumar, thank you, and I want to share with our listening audience, and for those people who are considering Plymouth Place, those facts about being safe and secure here. In fact, Dr. Kumar is available 24/7 if there's a question or a protocol question, and he's always been so gracious to share with us the new best practice or an update. So, Dr. Kumar, thank you for that. So let's talk about the fall and winter. Lots of news as you're listening to various channels about how bad it could be, should be, might be. So Dr. Kumar, what's your thoughts on the fall and winter? What are we headed into? And is there hope and out there in the world? Certainly good news here at Plymouth Place, but what are your thoughts on what's happening?
This is a great question. It does ask me to speculate a little bit, but these illnesses, the respiratory illnesses, tend to be cyclical. And fall, the flu season, as we like to call it, fall and winter, is especially a bad season for respiratory viruses. Cold, which is a coronavirus illness, also takes off during this period of time. Influenza tends to complicate matters. And we're already seeing with the relaxation of social distancing and the stay-at-home orders that the cases in the community have been creeping up. So the consensus is that we will see presence of COVID-19 all through the fall and winter months. How does it affect our communities and how does it affect Plymouth Place in particular? I think that depends on how well we manage to practice our safety protocols, physical distancing, hand hygiene, masking, staying clear of other people unless we're absolutely necessary. Practicing good hygiene goes a long way. And, there is probably, we will talk about vaccine for COVID-19 at some point, but influenza vaccination is going to be available very soon for this season. And so September, October, all seniors and everyone, in fact, should partake of the influenza vaccine. If there are two major illnesses going around the communities wreaking havoc, at least if we can contain one, then we can isolate the other one and deal with it in a much more efficient manner. But if influenza takes off and becomes a pandemic at the same time as COVID-19 is one, then all bets are off. We are in thick soup at that point.
So what you're encouraging really everybody is to, A, get the flu shot. And those vaccines are readily available. And you'll hear more if you're here at Plymouth Place. We'll be providing those flu shots to you in early September. So more to follow on that. That's just right around the corner. And again, more news to follow. So A, that's important. And, you've been hearing about the vaccine. It's a little confusing because you hear the government has spent about $2 billion already on a vaccine, and we don't really know much about it. This is the COVID vaccine. I know some of it is, I guess, estimate, but what are your thoughts on the current production of a vaccine for COVID?
There are many. Last count, there were 34 different companies across the world participating in trials. Majority of them are in what we call phase 3 clinical trials. So these vaccines have been proven to be safe, and the phase 3 clinical trials measure their clinical effectiveness. And Dr. Fauci and CDC have already committed that even if they're 50% effective, they are going to be good vaccines and the FDA will likely approve them. But we are hopeful that the effectiveness will be much higher. Just to compare, the average flu vaccine is about 80% effective. So if we can get to that range of efficiency, then we have good hope that we can control COVID-19 this winter. We are hopeful that the first batch of vaccines might become available in October, November, at least by the end of the year, so December. But it is not going to be enough to vaccinate the entire population of our country. So the first batch might be reserved for the most vulnerable seniors, perhaps those who are living in nursing facilities, those with chronic conditions who are immunocompromised, and perhaps the frontline workers, so healthcare workers. So Plymouth Place and our staff will be on that list. So I'm hopeful that at some point before the end of the year, we'll have a COVID-19 vaccine available to our residents and our staff.
That would be excellent. And as you were saying, Dr. Fauci, even if it was 50% effective, that would be a good thing. That's an interesting comment. Now, why that stat? Why not 70? I mean, the more the better, but why 50?
Right. A vaccine, for it to be effective, it depends on multiple factors. The vaccine itself, it induces immunity by introducing the viral antigen to a recipient's body. But the body has to process that antigen and mount an immune response. So we have to make antibodies. But the same criteria that defines an immunocompromised patient, just like the influenza vaccine, now we have high-dose vaccines because the seniors were not responding to the traditional flu vaccine at the small dose that everyone was getting. So we've doubled the dose so they can mount a good immune response. So this is the first time we're making COVID-19 vaccines. So we don't know if 100% of the population that receives the vaccine will become immune to this virus. There is also the concept of mutation. The virus keeps changing. So the vaccine that's designed is made using a particle of the virus. And if that particle has mutated, the virus may not be as affected by the vaccine as if the mutation hadn't occurred. So there are many things that go into, it's a very tricky virus to build a vaccine against, but we are hopeful. I mean, 50% was just a threshold that Dr. Fauci said, because we are so desperate, because this is such an evil disease. He felt that even 50% would make the vaccine a good thing. But we are all, as physicians, hopeful that the efficiency will be much higher than 50%.
I remember, I believe it was in March when we first did I think it was a Zoom meeting, you'd mentioned the evilness of this virus is simply because it spreads quicker than the flu, and that was a little alarming to me at the moment. And it's because it's airborne is really. Now, let me ask you, so they now believe that it is an issue on surfaces, but maybe not as much as they first thought. But the airborne quality of this virus is really the devil in the detail. Is that correct? Is that true about coronavirus?
Yes, it does spread from human to human, whether through fomites like contact. And I was just reviewing some data on how long it stays on the surface of various substances. There are certain substances like copper, for example, which have some antiviral properties. So the decline of the infectious nature of the virus after being introduced on the surface of copper goes down pretty rapidly. Within a matter of 4 to 6 hours, it becomes almost inactivated. But if on a cardboard box, like an Amazon box that you get, it could linger, especially if it is present in a large amount. It could linger on the surface for a day or two. So that's why we advise caution. But the airborne spread is the biggest challenge because you don't see the virus. And so we are, sitting here talking, and even while we are speaking, we are aerosolizing. We can't see that. And that gets suspended in air. And if there is no air movement, like in some buildings inside, that can stay suspended in air for a length of time, and the other person can inhale it and can get sick. So that is the reason why this is a very dangerous disease.
Hence the, on and on again, the local officials saying do not congregate in large groups and so forth. such as a restaurant or a grocery store, I mean, those are not really good places unless you follow the protocol to make sure you're safe. So it's interesting. Illinois seems to be one of the better states. Oddly enough, we weren't 3-4 months ago. So we're holding our own, which is good. But states to the south and the southwest are not doing well. In fact, a couple weeks ago, it was stated that Florida has more COVID cases than all of Europe, which was quite stunning comment. So why do you think in those areas there's 3-4 times more COVID? What's happening down there?
Yeah, that's a great question. Illinois, majority of the COVID disease was seen in the city and the suburbs, maybe. We really didn't have as much activity here, say in LaGrange, as Cook County did. I mean, this is Cook County, but that's, like city of Chicago. The reason is the proximity and the activities that we talked about, the restaurants, the bars, where people mingle, and young crowd who sometimes tend to get brash and reckless, and they don't follow the guidelines because they feel they're invincible. The same thing is happening in the South. People are not, either because of their beliefs, their preferences, or in some weird way, they think their independence and freedom is being infringed upon, and they don't want to wear masks, they don't want to go distancing. And it is also the summertime, people are hitting the beaches and they're using their vacation time. And when you do that, when we don't practice physical distancing, then the disease spreads like wildfire. And that's what is happening in Florida right now, and the same thing in Georgia and Texas.
Yep, makes sense. So it's just the number of people vacationing and out and about and so forth. Well, hats off to Illinois that's holding their own. Maybe segue to an interesting topic, and this one is a tough one for some of our staff. They have little ones, grade school, high school, at home still, and some of the schools have said, well, we're going to do e-learning, long distance learning, if you will, all virtual, iPads, computers, and then some are going to do a combination of on-site and e-learning. And I don't know any that are doing all on-site. I'm just curious, and I believe you have children. If it was your child, what would you prefer? What do you think is right?
That's a very difficult question to answer. I do. We have twins, and they are Hinsdale Central juniors this year. The challenge is this is their critical year. This is where they're in all AP classes, and it's very difficult to take these classes online. And when the school district said we are going to offer in-person sessions, we did sign up with trepidation. We did get all kinds of really good masks and sterilizers and whatever they needed. But we also know that generally the kids do well. It is actually the risk of transmission from them to parents, grandparents, and thankfully my mom was visiting, but she went back. It's just me and my wife, and we are in relatively good shape, and but we don't want to jeopardize the kids' education, so we did accept that. But thankfully, the decision was made at the state level, and our district was one of the last ones to comply, but they finally came around and said, all education, at least in the foreseeable future, will be online. I don't know of any school that is still pursuing in person, but that might change if the community penetration of COVID-19 decreases, or if the vaccine becomes available, things might change. But I'm fearful that the first semester, at least, is likely going to be online.
Yep. Yeah, and everybody has heard on the news several colleges and universities who have already had some disastrous moments and the school hasn't even begun. And oddly enough, Plymouth Place has been asked to do a little bit of a consulting to help students be safe. We had a visit to a specific college in Dubuque, Iowa, to give them some consult to make sure they can do the right things. but it's hard with college students because they like to hang out, together. But there are some, answers there, and I think everybody's working it through. So it's just so interesting, whether it's at home, a college, university, a high school, or elsewhere, it's really the same thing. You have to follow the protocol to keep one safe.
Yes, well said. I mean, there's no cure for this disease, so it's all about prevention. And how do you prevent COVID-19? Good hygiene, physical distancing, wear your mask, wash your hands. And I know it's repeating the same message you heard 100 times over, but it works. And that's what we got to do.
And here at Plymouth Place, we do have independent living residents meeting their families now in the east end of the bistro, the Dixon Gardens, if you will. Some of them go with their families during the day, or some of them go out for a vacation. So we do have people who have freedom to do such. So a lot of good things are happening there. And as, again, reminder to all as you go out and about, just to, again, follow those safety practices. So I'm going to fast forward as we close here shortly and maybe look towards the future. And it's so interesting. There's many, many things that have come our way here in the world. H1N1, Ebola, the norovirus, the flus, and so forth. So corona isn't, that unusual, but really the unusual thing is the spread. That's because the coronavirus in itself is easy to kill. Is that correct, Dr. Kumar?
The virus is, the disinfectants that we commonly use, the alcohol sprays and gel, hand washing, they all inactivate the virus. It is how it spreads and how it acts once introduced into your person, because it is a severe inflammation that pretty much causes inflammation in your cardiovascular system and also the lungs. So it's not even an infectious pneumonia, it's more inflammation of the lungs. And it is very difficult to say who is going to get sick. You could be a very healthy, young 20-year-old versus an 80-year-old. The 80-year-old can survive, perhaps, and the 20-year-old might die. So there is some randomness to the victimization of this virus. That's what is strange and frightening. And people who get really sick get really, really sick. And again, there are treatments that have helped, but to this day, there's no cure.
Yeah. Well, let's forward ahead a little bit. So hard to believe that September 1 is around the corner. Labor Day is, I believe, September 7th. And summer's coming to a close. So if we look at 2021, the spring of 2021, what does it look like in context of COVID? What do you think? Where will we be? At what level? Will it be fully behind us? What are your thoughts, Dr. Kumar?
Yeah, the consensus from all of the experts, and again, I'm a physician. I'm not an infectious disease doctor. I do read up a lot on this, and even the most widely respected experts do feel that even with the advent of an effective vaccine, COVID-19 will still be here next year. In what capacity, to what extent will it endanger our lives, will depend on the timing of the vaccine, the acceptance of the vaccine by our populations, and the effectiveness of the vaccine, and our continued adherence to our safety and hygienic protocols, physical distancing. We can't take this virus lightly, and all of these things will determine the extent of a threat coronavirus, COVID-19 will be for us next spring. My guesstimate is that we will still have it, hopefully not as big a problem as it is today.
I think that's welcome news to our listening audience and our family members, certainly to us, as we wish to be, COVID-free forevermore. Let me ask you a quick question on COVID. It's very interesting. So we have seen, I think, out there that it's mutated from time to time, and it takes different forms. But that doesn't seem to be the case at this point, but we could be wrong. Do you know, is it mutating or will it? And maybe secondarily on a mutation, do you think there ever be a point where you can get it again? Our understanding is you cannot. Once you've had COVID, truly you can't get it again. What are your thoughts on that?
Actually, there's no 100% correct answer for both of those assumptions. There are case studies from Korea, from Italy, where people who have been infected and presumed cured tested positive again. We don't know for sure if this is just residual shedding of the original virus that persisted in the body and the damaged viral material is being shed continuously and it's still tested positive, or if it is a reinfection of the virus. The other thing that's concerning is the antibody levels over time, after even an active infection, especially for the asymptomatic carriers, tends to wane. And so at some level, when the antibody level is below a certain threshold, if they get reinfected, they could become and be symptomatic of an infection. So I don't think, even though the chances are less, that if you catch the infection once or if you are vaccinated, that you will get an infection, it could still happen. Just like the influenza, for that matter. I mean, we get the vaccine or we get sick this year, we might get sick again because it's a different strain. So when the mutation is so complete that it is almost a different strain of coronavirus, you could get reinfected. But again, with each passing cycle, the more our body is exposed to either the vaccine or the infection, the chances become less and less.
Well, this whole thing has certainly changed the world, and in many cases has made us think very, very differently, which is great because we've had to pivot and do things to make sure that everyone was safe and secure. As we close, Dr. Kumar, any other advice for our listening audience in relationship to, COVID practices, a little reassurance, anything else you'd say for our folks out there?
Yeah, I want to say two things. One, again, I want to commend you, Jay, and the team at Plymouth Place. Done a wonderful job in keeping COVID-19 at bay. But it is not time to take these precautions lightly, because this is what has kept us safe. And going forward, as I said, we could be looking at COVID-19 well into 2021, maybe even beyond that. It is important to remember that safety comes first, and every life is precious. Even if we think we are invincible, those around us, those near and dear to us, may not be. So please use the precautions as you've been using all these days and help everyone stay healthy. Safe social distancing, physical distancing, masking, and hand washing go a long way. Keep doing that, and hopefully we'll have a vaccine soon, and then we can be a bit more free in how we interact with the world.
Well, Dr. Kumar, we so appreciate you being here, and you're partnering with us to deliver excellence, being an advisor and someone who can help us, and really, most importantly, your passion to serve seniors as we are here together, serving seniors at Plymouth Place. That's so, so important. Again, thank you so much. So thanks again to our listening audience for being part of Plymouth Place 1902, and look forward to more sessions to follow. Thank you. Have a good afternoon. Goodbye.
Thank you. Bye-bye.